it takes a lot of learning before it starts to stick with you. But let's start with what is the difference between the sympathetic and the parasympathetic nervous system and what they do in the body.
Yeah. I think the easiest way I like to think of the sympathetic nervous system is the gas. And that internal alarm of hyperarousal. So it's on edge. It's going to be like, Mayday, right? It's going to be so quick to go there. And then our parasympathetic nervous system is the brake, and it's trying to maintain energy and conserve energy. It's trying to calm us. So when we're in that diffuse sympathetic arousal, is when our sympathetic nervous system is in that hyperarousal freak out state. Right. Yeah. And I think we've all been there at some point. We might notice flushing skin, sweating, shaking. We might feel tense. There's all these different symptoms of what's happening in that moment. Increased heart rate is definitely one of them. So when your heart rate gets to 100 beats per minute, that's what John Gottman would call flooded, or being in diffuse sympathetic arousal. I'll probably use the term flooded because that's what I use with my therapy clients. Yeah. It's easier to pronounce.
And relatable, at least for me. Very relatable.
Thank you.
A term I use even with my 11-year-old when she's in a freak out mode and I'm like, hey, you're very flooded right now. Like maybe we just need to take a breath because this conversation isn't helping or going anywhere. We have to like get into calm. Yeah.
Exactly. And so it's the recognizing that, and then what can I do to help my body calm down? Because in that moment, it's actually, there's so many things going on. Let's use an example of, let's say that there was someone who was in a really traumatic relationship and now they're starting a new relationship and they are feeling, they got triggered. Maybe it was just simply their partner is in a bad mood, but when someone was in a bad mood before, shit went down. And it got scary.
That meant
so
it was
now
about
her
to be
hippocampus,
dangerous.
that is her storage cabinet of her brain, it's very close to her amygdala, which is where that freak out part of our brain is that is going to be flooded. And so, especially with post-traumatic stress types of situations or chronic stress, it's going to trigger that freak out even faster. So when we go into that flooded state to calm our brain, we really need to take some deep breaths, because all of the blood in our body is actually going to different places to protect our internal organs. Cortisol is being dumped into our gut, which is where it's produced. You might even have a stomach ache. Your heart rate is going up. The blood in your brain is not going to the good thinking and the communication skills. It's going to the survival mode. You are no longer able to communicate, to think clearly, to grasp and understand what someone is really telling you. And we have to calm down. So it's either through deep breathing, I think going outside, I think taking a cold shower, splashing cold like temperature, thinking about like sensory things. I like to use a lot of mindfulness, and that really incorporates what are you seeing, thinking, smelling, like kind of remind yourself and shock your nervous system out of that state.
Yeah.
Or calm yourself, do something completely unrelated to whatever is irritating you. Go garden, go pet your dog.